In this video, we'll break down the roots of America's mental health emergency, explore the warning signs across generations, and ask a tough question: are we doing enough? Or just watching it get worse? In America today, the mental health crisis is a silent epidemic, touching every corner of society, every demographic, and every community. It is a crisis that has been decades in the making, shaped by cultural stigma, economic pressures, systemic inequalities, and a healthcare system often ill-equipped to provide timely care. Understanding the scope and depth of this crisis is essential for finding a path forward, not just for individuals, but for the nation as a whole. For many Americans, the struggle with mental health begins early. Children and adolescents face increasing rates of anxiety, depression, and behavioral disorders. Pressures from academic achievement, social media, and unstable home environments can create a perfect storm for emotional distress. Adults, too, are not immune. The modern American lifestyle is often defined by relentless work schedules, economic uncertainty, and the expectation to always be on. Social media, while connecting us, can also amplify feelings of inadequacy and loneliness. For many, the pressure to succeed, to provide, and to keep up leaves little room for self-care or vulnerability. For some, this pressure manifests as anxiety or depression. For others, it can lead to substance abuse, self-harm, or thoughts of suicide. Older adults, meanwhile, face their own set of mental health challenges. As people getting older, they may grapple with the loss of loved ones, declining physical health, and social isolation. Stigma surrounding mental illness can be particularly acute in older generations, making it harder for them to reach out for help. The result is a growing population of seniors who suffer in silence, their needs often overlooked or dismissed. The numbers tell a sobering story. According to recent data, nearly 1 in 5 adults in the United States lives with a mental illness. Suicide rates continue to climb. Now, suicide is the second leading cause of death for Americans aged 10 to 34. Emergency rooms across the country report a surge in visits related to mental health crises, straining an already overburdened healthcare system. Access to care is a central challenge. For many, mental health services are simply out of reach, geographically, financially, or both. Rural communities often lack mental health professionals, forcing residents to travel long distances for care or forgot it altogether. Even in urban areas, the cost of therapy, medication, and treatment can be prohibitive, especially for those without insurance or with high-deductible plans. Waiting lists for appointments can stretch for weeks, even months, leaving people in crisis with nowhere to turn. Systemic barriers compound these issues. In marginalized communities, communities of color, immigrants, and those living in poverty, the challenges are even greater. Discrimination, language barriers, and cultural mistrust of the healthcare system create obstacles to seeking and receiving care. Historical trauma and ongoing inequities mean that mental health struggles are often intertwined with other social and economic adversities. The criminal justice system has become, by default, one of the largest providers of mental health services in America, a tragic reflection of the gaps in traditional care. Jails and prisons are filled with individuals who would be better served by treatment than incarceration. Law enforcement officers are often the first responders to mental health emergencies, yet most receive little or no training in crisis intervention. This can lead to tragic outcomes, including unnecessary arrests, use of force, and even death. Stigma remains a powerful force, preventing people from seeking help and perpetuating cycles of silence and shame. Despite growing public awareness of mental health issues, many still fear being judged, ostracized, or seen as weak. This stigma is reinforced by media portrayals of mental illness as dangerous or unpredictable, and by workplaces that fail to accommodate or support employees facing mental health challenges. Yet, amid these challenges, there is hope. Conversations about mental health are becoming more open and honest. Celebrities, athletes, and public figures are sharing their stories. helping to break down stigma and encourage others to seek help. Schools and workplaces are beginning to recognize the importance of mental well-being, offering programs and resources to support students and employees. Telehealth has emerged as a powerful tool, expanding access to care for those who might otherwise go without. With the click of a button, individuals can connect with therapists, counselors, and psychiatrists from the privacy of their own homes. While telehealth is not sufficient, technology gaps and privacy concerns remain. It represents a step forward in reaching underserved populations. Policymakers are also starting to take action. Efforts to integrate mental health care into primary care settings, expand insurance coverage, and increase funding for crisis intervention are underway. The 988 Suicide and Crisis Lifeline, launched in 2022, offers a new way for people in crisis to get immediate help, connecting them with trained counselors who can provide support and resources. However, true progress will require a fundamental shift in how America views and treats mental health. It means investing in prevention as well as treatment, building resilient communities, teaching coping skills in schools, and addressing the root causes of trauma and stress. It means recognizing that mental health is just as important as physical health, deserving of the same attention, resources, and compassion. It also means listening to those who are struggling, to families and caregivers, to professionals on the front lines. Their stories are powerful, and they are the key to understanding what works, what doesn't, and where the gaps remain. The mental health crisis in America is complex, shaped by forces both visible and invisible. It is a crisis that affects millions, directly and indirectly, and its impact ripples through families, workplaces, schools, and communities. But it is not insurmountable. With collective action, empathy, and a commitment to change, America can build a future where mental health is prioritized, stigma is shattered, and everyone has the support they need to thrive. The path forward will not be easy, but it is one you must walk together for the sake of your nation's well-being and for generations yet to come. If this message helped you, share it with someone you care about. Because we rise by lifting others. Like, share, and subscribe for more videos on humanity.